Hello, I'm Greg Stevens, and I'm running for State Senate in California's 36th District. As the time of this taping, it's Tuesday morning, and I have not slept for the past 24 hours because I got an opportunity to experience healthcare California style last night. My wife became very ill and needed to go to the emergency room. So we went and signed in and did all the proper paperwork, had our insurance cards, had everything we needed, and then found out that the waiting room was full of people that were actually going to be seen. They told us, prepare for yourself for 6 hours. As I sat in the waiting room, I began to observe and notice things going on around me. And I noticed one man who was signing up and being admitted, and they asked him if he had insurance. He said no. They offered him California medical insurance right there on the spot, to which he declined. I thought, man, this guy is either very principled or not very smart. I watched him a little bit later as he was playing cards with another guy and laughing in the emergency room, all while very sick people were in there as well. I thought, why is this guy here? Later, I watched a man be wheeled in a wheelchair with handcuffs around his wrist and 2 Border Patrol agents escorting him. He had twisted his ankle entering our country. For the entire night, 2 of our brave Border Patrol agents sat with this man as he waited to be treated. I thought, what a waste of resources to have our Border Patrol setting at my local hospital. So I began to notice other things. As we went back into the room finally toward the back, the entire hallway was lined with people laying on gurneys. These are the people who had come in on the ambulance. One nurse stopped and saw this one patient and said, "Well, you were here last week with the same problem. How are you doing now? What happened? Do you have a relapse?" They had just learned the system that if you take the ambulance and tie up the fire department, you get to go straight in instead of having to sit for 6 hours in the lobby. Well, I thought there must be a lot of emergencies tonight. There must be a mass casualty. There might have been an earthquake and I missed the entire thing. That's why the hospital is so full. Well, when we got back to Suite C in our group of rooms, I watched as the nurses ran themselves crazy the entire night as my wife was being treated and tested for what was wrong with her. You see, 3 of the 4 beds near us all had transients in those beds. And granted, they had some mental problems. But here's the ironic thing. A security guard and a nurse was posted with each transient that was taking up a bed. And I realized there are sick children sitting in the waiting room while these homeless people are in the beds. Now, I don't have anything against homeless people, and I don't have anything against people who are not all there with their mental faculties. But what I do have a problem with is them working the system and being frequent flyers, as one nurse put it. Frequent flyers. They're in here every week. They were catering to them and running around and ordering tests, and the lady next to us had been to the hospital 3 weeks in a row. And they ordered an EKG on her, and they ordered chest x-rays on her, and they ordered blood work on her, and a complete cardiac workup on her, and they could find nothing wrong. And so I asked one of them off the record, "Why do you do that?" And they said, "Well, if we don't, we're liable to be sued. And we have to treat anyone that comes in to the emergency room." So I thought, what's the big deal if you have to treat people that are uninsured anyway? And they said, "Well, it's just the name of the game." I said, "Well, this is Monday night." And they said, "It's this way every single night of the week." So that got me thinking a little bit about the healthcare crisis we're experiencing in our state. You see, just recently, the California State Senate tried to pass, once again, universal health care, a lot like Massachusetts has. And I hate to say this, but it was a Republican Governor Romney that gave Massachusetts universal health care, and it's not working out. This is one reason I'm glad I don't have his endorsement, nor have I sought any endorsements from the mainstream career politicians. So I got to thinking about a few things, and I've talked this over with several doctors. Let me ask you what you think. Here's some of my ideas for health care. Number 1, If I can buy car insurance across state lines and I can buy life insurance across state lines, doesn't it make sense that I ought to be able to buy health care insurance across state lines? You know, as a business owner, we provide health care for our employees, and we have health savings accounts, and they work well. But wouldn't it be great if I could buy Blue Cross of Utah cheaper than Blue Cross of California and make that competition work for my benefit and for the company's benefit? So I think portability in healthcare is very important. We obviously have to do something about tort reform so that doctors don't feel like they have to order all those tests on those patients I saw last night. And you guess who paid for it? That's right. I paid for it and you paid for it. And all of our healthcare costs went up. How about this one? How about giving dignity and helping doctors? Giving dignity to families, let's say family A can't have health insurance, they can't afford it. But Dr. B all of a sudden takes family A as his patient. He treats them the same as he would treat anyone else, and he treats them for free. So what's the doctor get for it? The doctor gets a tax credit from the state of California on his income tax. And so therefore he has an incentive to treat this patient. Now you have a family that has the dignity of having their own private doctor, which was part of the problem last night. The lady listed UCSD as her private doctor. They said over and over and over, UCSD cannot be your doctor. Who is your doctor? And once again, she goes from emergency room to emergency room to emergency room and uses it as a clinic. Now, say if a family had a private doctor that is their doctor and he becomes or she becomes their patient, because you get an incentive to write that off up to a certain amount off on their taxes. How about this? Let's say there's a new doctor and you just graduated from medical school. Let's say instead of a tax credit from the state of California, we forgive, like they do with law school, we forgive a certain portion of your student loans. You know, sometimes those student loans are $500,000 or more. But let's say in the first few years of your practice, as you're building a practice, you take an uninsured patient to become your patient, and you get to write off a certain percent of that, or you get to have that forgiven for your student loan. Now, every doctor I've ever talked to said this is a great incentive for me. I would do that in a second to be able to have a tax credit. I would take an uninsured patient and make them my own for a tax break because they need the help. Two things happen. Doctor gets needed break in income, and the uninsured actually get treated with dignity. These are just a few ideas. I would absolutely love to hear what you think of this and what you would like to tell me about your experience, like my experience last night. It was a real eye-opener for me. The career politicians aren't going to come up with the ideas, but I know that common people, regular guys, we the people, have the ideas that will work. I promise I'll listen to them. I'm Greg Stevens. I'm running for state senate. We the people deserve better.